Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, giving you the update on the coronavirus from Albany Med. Today is Friday, May 8th. In the 5 counties, we are reporting 2,945 people have tested positive for COVID-19. More good news inside here in the medical center. The number of people we're currently treating for COVID-19 is 46. That's down from yesterday.
That's right.
We have 31 on the floor and we have 15 in the ICU. We currently have 7 on ventilators. I believe yesterday, Fred, we admitted 4, we discharged 6, and there were no one who died yesterday.
No deaths yesterday.
Which is wonderful news.
It's very good.
There's a document that we're going to pop up on the screen here. We're going to start with. This is a grid which was published in one of the governor's press conferences earlier in the week. And it talks about how to open up various regions of the state. So I'm just going to orient you to the slide for a second. It breaks the state down into several different regions. We are at the very top. We're defined as the capital region. It's 8 counties. If you go north to south, it's Warren and Washington County, Saratoga, Schenectady, Rensselaer, Albany, Columbia, and Greene. And when you go across, you have various different categories of areas that you have to be green in order for the region to open up. And Fred, when they open up, it's going to be in 4 different phases. So they took it as the 7x4 grid. So 7 criteria in 4 phases. And when this grid was published, there was 4 areas that we were positive in as a region, and there were 3 that we still needed to get green in.
That's right.
And I want to focus on the very first column because that column we are red in as a region, and the category is either a 14-day decline in admissions or under 15 new admissions, and both of those are 3-day averages. And we wanted to talk about that because this is something that I know we're talking with the other area hospitals about each day.
That's right, Dennis. So every morning we get on a call, and we've talked about this before, at 7:45 with 11 other hospitals in our region, which encompasses actually not only those 8 counties, but a little bit larger area. And we share our statistics, how many patients were admitted, how many patients were in the intensive care unit, everything that's important in terms of talking about the patients in the hospitals. And we think that over the last 3 days, on average, we admitted less than 15 individuals from the 8 counties in the capital region. So that's very good. I think perhaps the grid the governor showed was a little dated in terms of the information on it, but we think when that's looked at again that we're gonna be there in terms of that reduction in admissions.
The dates originally were April 17th to the 27th.
That's right, Dennis. And we're talking about, obviously, the last 3 days, which is much after that.
Let's put up the grid again yesterday that we spoke about, just to orient you. If you didn't see this yesterday, on the horizontal axis are various days. Above the horizontal axis are admissions to the hospital, and below that are discharges or deaths. And there's a purple line which represents the census inside the medical center here of people who are positive for COVID-19. So this grid, which we showed yesterday, Fred, this was just for Albany Medical Center, but in many ways it replicates what's happening in the region. And as people can see on the grid, it's coming down. So we think that when we rerun these numbers, that the region is going to meet the criteria.
That's right, Dennis. We represent about 40% of the hospitalized patients with COVID in our region.
And this is important because county health officials and others have reached out to us and said, when can you expect the region to meet the criteria in that first area? So we're going to try to get that information as timely as possible and give it back to them.
That's right.
Very good. The waiver. So great news yesterday. We spoke about that. Let's dive a little bit more into that. The waiver that we have been granted, thanks to your efforts, Fred, and many others, is the start of cases on Monday at South Clinical Campus for elective procedures. Let's talk some more about that.
So that's right, Dennis. So we start on Monday. South Clinical, I'll remind everyone, is about a mile away from the main campus, fully contained, able to do everything necessary to care for patients right at that site. We are going to start slow and carefully. So on Monday, actually, we have 18 patients scheduled for surgery. They will come tomorrow. We have a drive-through tent in the back here on the main campus. They will drive through and be swabbed and tested for COVID. We want to make sure that they're negative before we operate on them. So on Saturday, they'll be tested. We'll have that information Sunday morning and be able to act accordingly. And then the next 2 weeks, Dennis, believe it or not, are all set. They're filled up already. That's how many people have been waiting.
This is incredible. Before COVID-19, there were basically 3 different areas that we did surgery in. We did them at the Niskayuna Ambulatory Surgery Center, the main campus, and South Clinical Campus. During the last several weeks, we've been doing only essential surgery here, turning on the elective cases, as the state calls them. We're only going to be able to start at South Clinical Campus, but it is certainly our expectation as we go forward to demonstrate we can do that safely and continue to do those on those other places as well.
So we would expect to make changes after 2 weeks, expand once we've demonstrated we can do this safely, appropriately, not burn through too much PPE, etc. And I have every confidence that we will advance after those first 2 weeks.
We've talked about this being an advocacy issue for the region. There are 3 different types of hospitals that are going to be able to go forward with surgeries. There's Saratoga Hospital and Nathan Littauer, which were in counties that did not have a prohibition on that. They've been doing these elective cases
That's right.
for a little bit. Then there are hospitals that have recently applied for waivers and have gotten them, like Albany Medical Center. So along with us, we're very pleased to announce that Glens Falls Hospital, Columbia Memorial Hospital, St. Mary's Amsterdam, and St. Peter's have gotten that. And so we're really happy for those hospitals that they can start as well. And I think there's one other that we're hoping for.
That's right. And the other hospital in the region is Ellis Medicine in Schenectady. You know, frankly, Dennis, we're a region. We provide care for people throughout the region. We think that Ellis ought to get their waiver and be able to start doing surgeries along with the rest of us. And hopefully that'll happen today or in the next couple of days.
And we all signed letters in support of each other.
That's right.
And we sent that to the state. So we certainly hope they'll get good news soon. We've talked about antibody testing here, and I think we have some more good news. It's Good News Friday, as we say. What's the good news on antibody testing?
So our antibody system is in-house. The testing system is in-house. It's been validated. And so on Monday, we're actually going to start doing some testing. Now, the antibody test doesn't have a lot of clinical value acutely when you're taking care of patients in the hospital. But it does have value in terms of understanding what the infection rate has been like. So we're actually going to do a research study with the relatively small amount of reagent we have to do this testing. And that research study is going to ask for volunteers from our staff.
Our staff.
So you have to work for Albany Medical Center. We're going to have half of the staff that volunteer that have been tested, and that's about 1,000 staff members now, and half that haven't been tested. And we're going to see what the prevalence of antibodies are in those 2 populations. We think we'll learn something about the prevalence and how this disease has moved around in the population.
And this will go through our IRB?
Yes, the Institutional Review Board, which is an entity that reviews research really to protect research subjects, make sure we're not doing something inappropriate with them.
And we'll share those results when we get them?
We will share them when we get them, perhaps the end of next week. We'll see how long it takes to do the study.
We mentioned that we're going to talk a little bit about Kawasaki's disease because this has been in the press, so let's talk about that a little bit. This is a disease normally seen in children. It also goes by the name mucocutaneous lymph node syndrome. It's a constellation of findings in children often with fever, with enlarged lymph nodes. They often have red eyes, conjunctivitis. They have a tongue that resembles a strawberry. And this is a seasonal thing. We often see this in the wintertime. The actual etiology of cause of it is not entirely known. And recently there was some publications that suggested there was some clustering of that, and was it related to COVID-19? And I think some of our doctors have offered an opinion on that.
So we've actually had a few cases of this, and we have a few cases every year in the wintertime of Kawasaki's. The children that we've had that have presented with symptoms, signs and symptoms consistent with this, actually 2 of them have tested negative for COVID, and one of the patients did test positive for COVID. Whether it's related or not is unclear. All of the children have done extremely well.
And I think the advice we like to give to people who are watching is if you're a parent, there's really no reason to be concerned or alarmed at this time.
That's right.
All right. T-shirt time. So it's Friday. I'll go first. Dr. Crane is a doctor in the emergency department. He has a friend named Krista Walsh who made this shirt. And I believe it says, anyone, anything, anytime. That's a nice message. That's what our workforce is prepared to do. That's what they do. Certainly not only our nurses, but everybody else. So I'm very proud to wear this on a Friday, and I think you have something as well.
So today is the last day of Nurses Week, and I'm wearing a CRNA T-shirt. CRNAs are certified registered nurse anesthetists, so they're nurses who go through specialized training to provide anesthesia under the supervision frequently of an anesthesiologist, but sometimes not. So they're very high-powered nurses. They usually come out of our intensive care units,
Right.
so they're critical care trained. And during the COVID circumstance that we've had, they've actually stepped into the breach in some of our critical
have.
care units and helped. So shout out to the CRNAs.
We have a school here for them,
We do.
and many of them stay on with us.
That's right. One of only 2 schools, I think, in New York State.
Last thing, there was another poll, another informal poll that came out with the same scientific scrutiny as our saluting. And the poll was, who had a more soothing voice? And I can say unanimously, Fred, it was you. They all say your voice is much more soothing than me. And in fact, I think my wife also voted for your voice. So I'm not sure what that means, but
Sorry, man.
but I also would vote for you. It calms people down, and that's what we're trying to do here. We're trying
Absolutely,
to
that's
send
what
a
we're
very
trying to
clear
do.
message of basing science and what's happening. And,
Get the information out
Right.
there without the hype.
right, so we'll let you give all that good news next week.
Okay.
All right, we're on to the weekend. We hope you don't get too much snow. A happy Mother's Day to those who will be celebrating that. Wish you all a good weekend. Please take care of yourself, take care of each other, and we will see you Monday.